Hello everyone, it is Derek, product manager over here at Patient Studio, and today I wanted to talk about electronic eligibility. It's kind of one of the more exciting technologies that's kind of emerging as we continue to move forward and have better data. We're able to streamline some things like eligibility, and so I'm going to kind of walk through what electronic eligibility looks like, how it works. And yeah, one of the key benefits is obviously we're going to get the eligibility and benefits information, but more importantly, we're going to eliminate those long phone calls to get eligibility, and we're going to get those results in real time. So I'm just going to run through a quick example here so you guys can get a good understanding of what's involved. So if you're using the Patient Studio product, all the information will come off the intake form right into this insurance, in which I can run eligibility. If you're not using the Patient Studio product for intake, you can still enter in the information here, some key pieces like the name, the date of birth, the relationship to subscriber, as well as obviously the policy ID. So I'm going to simply come in here and hit run eligibility. And this happens in real time. So anywhere from 5 to 10 seconds, we're going to get some results back, and I'm going to kind of share those results here with you guys. Okay, so after the eligibility check comes back with the results, here's kind of what we would see. So I'm going to go through these kind of briefly. Obviously, you can stop the video and kind of look at it in more detail, but I just want to kind of scan through and kind of show you some of the information you're going to get back. It's going to show me the name of the plan, when the coverage effective date has started, as well as some general, deductibles, in-network, out-of-network, where they're currently at in the process versus what their plan is. So this may help in some price estimates. It may be helpful for some price estimates. Again, I'm going to kind of scroll through this stuff somewhat quickly just to allow you guys to stop the video and look at it when you want. So we also get broke down by discipline, right? So if you're working in emergency services, what's my breakdown in terms of cost? Is my copay different? Co-insurance? Do they have coverage for my specific discipline? So I'm just going to kind of scroll through. Perhaps I work at a chiropractic office and I want to understand if they have any visits, how many visits they have remaining. You can see here I have 3 visits left and I have 24 in my plan. So I'm just going to kind of keep scrolling through here again so you guys get an idea of the breadth of information that is back. Inpatient, outpatient if you're hospital. Again, here's a good example. It really depends on the payer, what information they decide to send back. Some payers will send different information for different disciplines. Here for mental health, we didn't get much back. We just got that was active coverage. And again, that's going to really depend on the payer and what they want to send back. Here's physical therapy. You have 3 visits, remaining 30 visits total. So again, that's very helpful to understand. Urgent care. And so that's going to give me my results there. And one other thing that's really nice with Patient Studio is if I came back to this particular insurance, it's going to show me the last time I ran a check. So if it's been a while since you've ran a check, you may want to run a new one, or we can just go in and again click on the last check and it will bring up those results again. So you don't have to rerun it. So we store those results for you. So again, what information is available really depends on which payers. If you want to know what your payer or your payers would provide, fill out the link below, give us your 3 top payers, and we will get back to you or show you an example of what type of information you can expect, and you can determine, hey, this would be very, very helpful, or no. Obviously, as time continues to go through, payers are providing more and more information, and hopefully soon we'll get to a point where there is a full coverage of every different discipline through every different payer. But for now, highly recommend checking out to see if this would be something that would be useful to you and save you a lot of time. Thanks.